Recently, NMC has introduced reflection in the curriculum of medical teaching. Today I will tell you what is reflection and how you can do reflective writing. Reflection is basically arriving at a new knowledge by reflecting upon the prior knowledge that you already have. It is a mental process of thinking and analyzing an event and then using the conclusion that you get from that thinking process to plan your action in the subsequent event. Now, basically, I will tell you how you can do reflection. First of all, you have to think about that particular event, go back in the time and think about that event. After that, you have to feel the feelings that you were having at that time and note the feelings down. Then you have to derive conclusions from those feelings. You have to analyze those feelings and then you have to plan your further action. So this will help you to evolve into a better person and do that particular past. If you are exposed to that event, you can perform better. A lot of people have given different steps of reflective thinking or how to write reflection, like Gibbs, Jones, Rolfe. I will not go into the details of that. Rather than I will tell you how practically how you can do reflection and write reflective writing. Now, suppose I will give you example. Now, suppose there is an event in the ward, like there was a patient, a respiratory patient, who was having cough and was admitted recently. First of all, an MBBS student, a second year student saw that patient. Later on, their intern saw that patient, and after that, a resident saw that patient, and then the consultant took the rounds. Now, somehow the resident missed the diagnosis, and the patient showed him the report of sputum, which was positive for Mycobacterium tuberculosis, but the resident did not check the name of that report, and he misconcluded that the child was having tuberculosis. So these 4 people witnessed that event, and now see how these 4 people are writing their reflections. Now, what happened? The second year student is writing. Today I attended the rounds in pedia ward. I was completely lost and was not concentrating enough. And I did not understand what was being taught. Then in the middle of the rounds, the consultant scolded my seniors for not wearing masks and for showing some wrong report. I got really scared and wondered if she would scold me also. She seems to be like a very strict consultant, and I need to be more careful around her. I'll try to concentrate more carefully during the rounds next time. Now, the same thing the intern is writing. Today, I observed an interesting case during rounds. This 12-year girl was having cough since 12 days. I had not examined her, but my senior told that she was having crepitations in her right axillary area. My senior asked me the causes of cough, which I did not know, and I felt really ashamed of that. Then he showed me the report of her sputum test, which was positive for Mycobacterium tuberculosis. I thought that I should have been wearing mask, which I had totally forgotten today. My senior also did not remind me of wearing mask. That made me really scared. But then the consultant took rounds and scolded my senior as he was showing a wrong report of another patient. He did not check the name properly. Consultant also scolded me for not wearing mask. I really felt terrified of her. I learned that I would look at the reports carefully myself and always remind my juniors to wear mask. I also must read the respiratory chapter properly so that next time if I am asked questions, I can answer them correctly. So now the same thing is being written by the resident. He is writing, today I came to the wards in a hurry to see the patients. I was late. The patient on bed number 5 who was admitted yesterday was having cough since 12 days with respiratory findings. I had a biased view since the beginning. I presumed that she was having tuberculosis. Hence, when she showed me the report, I jumped at the conclusion and did not check the report properly. Had my consultant not looked carefully, we would have started ATT. Although I was scolded, but I learned my lesson that I should be very careful while reading the reports. I will not keep up prejudiced thinking, and most importantly, I will try to reach earlier to the wards tomorrow to avoid such mistakes. Now, the consultant is also reflecting, and his consultant writes, today I attended the consultant wrote, today during the rounds, my resident presented the cases very well, but for one mistake, I scolded him very harshly in front of his juniors. I felt somewhat very bad after scolding him too much. Everybody does mistakes. I could have told him coolly also. It is my responsibility that they don't develop too much stress while dealing with the patients. I would keep this in mind next time. So, same event, 4 different people, 4 different perspectives, and each of them are learning a different lesson. So, this is what you have to do in the reflection. You have to describe the event, but don't waste too much time in just describing the events. You have to feel what you were feeling. You have to write down those feelings, and then you have to analyze, and then you have to understand what you could do so that you can perform better or evolve after that event, after learning from that event. Thank you.